Another great way of assessing your range of motion of the knee in full extension is standing and flicking your knees back into extension. So when I flick my knees back, I can check the left side and I can check the right side, and I'm looking for the availability of the joint to go into full extension without pain. And then I may weight bear completely on the left leg, push it back, and completely on the right leg and flick it backwards. And this is what it looks like from the side, left side, right side, and both sides. If those movements reproduce pain and you're not able to get full extension, you're lacking extension range of motion, and it's probably limiting your ability to walk, play golf, do activities outside. So these techniques I'm going to show you are going to show you how to improve extension range of motion of the knee and decrease pain. Let's show you a technique on the table. This one, we just simply turn and check it out in this same position. I can lean back into the chair and I can do my passive flick into extension. There's the good side. Here's the involved side. And if it was restricted, I can now hang out here for minutes at a time, or I can work that quad again and start squeezing that muscle to get the knee into full extension. By doing it actively with the contraction and then passively with some flicks, you can improve extension range of motion and check it out immediately by standing and walking and seeing if you've improved range. If I'm flat on the table, I should be able to have my knee flat to the table. As you can see, my left knee is flat, and the heel lifts up off of the table. That's what a normal knee should do. Let's have a look at the right knee. So if I do that quad set, the heel is not popping up, and there's still some daylight between the table and the back of the knee joint. So if that's restricted, it gives you a nice self-assessment to see that you have a deficit. So I may work that joint by doing the quad sets and or providing the overpressure by pushing down on the top of the knee to passively stretch it into extension. Those are your self-treatment techniques to gain extension range of motion for a joint that's restricted in extension and keeping you from walking perfectly.